Okay, hi, it's Dr. Buford. We're just getting started on the left knee. This is our initial look inside the knee. Even with a little bit of suction, you can see some loose pieces floating around. See all these loose pieces here? And we will turn on our suction and evacuate those. That happens pretty quickly. And now here, without any mystery, is some of the problem here. This is the posterior horn of your medial meniscus. This does not look fantastic. This is torn. And this is what we're going to start to trim out with our shaver. We'll also use a pair of meniscal biters. You can see some chondral damage on the femoral condyle up above. And now we're going to look back here in this medial meniscus and with the biter and trim out the rest of this posterior horn. So here's our biter coming in. We're going to work through here. Okay, so we'll put our shaver back in and clean up the rest of this. And that's basically it. I think that'll take care of it. You can still see that there's some anterior horn left. We're going to leave that alone. You see how irritated and inflamed the joint capsule is here on the left. But at least now we've got that offending posterior horn resected. And that can't come back and cause any problems down the road because it's been resected now. Here's a nice pretty anterior cruciate ligament so we can see that your ACL is fine and intact. That looks pretty good. And now we'll look over here in the lateral compartment. You can still see there's some loose bodies in here, aren't there? Quite a few. Hold that. We're going to go to figure 4. Hold that. Push down. Table down a bit, please. And now we're just going to, you can see, yeah, that's great. You can see the lateral meniscus is torn too, this radial tearing. And since we're here, we'll smooth this back a bit. Okay, so we're just about finished on this lateral meniscus. We used a pair of scissors just to give us a nice clean edge, as you see here. The little fraying there I'm not too worried about. I just want to make sure there's nothing that could really cause mechanical symptoms and make sure all the loose pieces were removed. Okay, and so now we'll look up at the patellofemoral joint. Pretty certain there'll be some loose cartilage floating around up in this region too. So here's our shaver. Patella doesn't look too bad. You can see some of this inflamed fat pad. We really don't want to mess with that because it's very vascular. But as we look down the trochlea here, we can see that you've got some areas where the cartilage is a little bit degenerative as well. Okay, so we're going to finish up here in just a little bit. We're going to get you back to the recovery room shortly, okay? Good luck to you now. Bye-bye. So do we have anything? 1 second.